Hello class. Today, we will be delving into the fascinating world of osteomyelitis and septic arthritis. These are two serious infectious diseases that affect the musculoskeletal system. We will explore the microbiology behind these conditions, the diagnostic approaches used to identify them, the different treatment modalities available, as well as the complications that can arise. Additionally, we will discuss the management of these diseases in pediatric patients, the chronic forms of osteomyelitis and septic arthritis, and the intriguing phenomenon of prosthetic joint infections. But before we dive into these topics, let us first provide a comprehensive introduction to osteomyelitis and septic arthritis. Treatment involves a combination of antibiotics, surgical debridement, and in severe cases, amputation. Prompt and appropriate diagnosis and management are crucial to prevent complications and long-term sequelae such as chronic osteomyelitis, joint destruction, and functional impairment. The most common causative agents of osteomyelitis and septic arthritis include Staphylococcus aureus, Streptococcus pyogenes, and Haemophilus influenza in pediatric populations. In adults, Staphylococcus aureus remains the predominant pathogen, including both methicillin-susceptible and methicillin-resistant strains. Other bacteria such as Streptococcus agalactiae, Escherichia coli, Pseudomonas aeruginosa, and Klebsiella pneumoniae can also be responsible for these infections. In certain cases, fungal agents like Candida species may cause osteomyelitis or septic arthritis, particularly in immunocompromised individuals. To diagnose osteomyelitis and septic arthritis, a thorough clinical evaluation is crucial. This includes a detailed medical history, physical examination, and analysis of presenting symptoms. Laboratory tests such as complete blood count, erythrocyte sedimentation rate, C-reactive protein levels, and blood cultures can aid in the diagnosis. Imaging techniques such as X-rays, magnetic resonance imaging, MRI, and bone scans are also important tools for identifying bone and joint abnormalities associated with these infections. The management of osteomyelitis and septic arthritis involves a multidisciplinary approach. Initially, antimicrobial therapy is initiated based on the suspected or identified pathogen, along with appropriate surgical interventions if necessary. Broad-spectrum antibiotics are often used initially, followed by targeted therapy based on culture and sensitivity results. Surgical interventions may include debridement of infected tissue, removal of foreign bodies, drainage of abscesses, and, in severe cases, amputation. In cases of prosthetic joint infections, the removal of the infected prosthesis is often required. If left untreated or inadequately managed, osteomyelitis and septic arthritis can lead to a myriad of complications. These include chronic infections, sepsis, joint destruction, limb deformities, pathological fractures, and the development of biofilms. Identifying and addressing these potential complications is essential to improve patient outcomes. Pediatric patients with osteomyelitis and septic arthritis present a unique set of challenges. The diagnosis and treatment in this age group require specific considerations, including different pathogens and clinical presentations. Timely initiation of appropriate antibiotic therapy, pain management, and close monitoring of growth and development are vital in these cases. Chronic forms of osteomyelitis and septic arthritis present a persistent challenge in clinical practice. These infections can persist for a prolonged period, despite appropriate treatment, leading to relapses and the formation of resistant bacterial strains. The management of chronic cases involves long-term antimicrobial therapy, surgical interventions, and adjunctive therapies such as biofilm disruptors. Prosthetic joint infections represent a significant complication following joint replacement surgeries. These infections can occur due to hematogenous spread, contamination during surgery, or biofilm formation on the prosthetic surfaces. Treating prosthetic joint infections often requires a combination of surgical interventions, such as prosthesis removal, and targeted antibiotic therapy to eradicate the infection. The epidemiology of osteomyelitis and septic arthritis varies among different populations and geographical regions. Factors such as age, underlying comorbidities, and socioeconomic conditions can influence the incidence and prevalence of these infections. Understanding the global burden of these diseases aids in the development of preventive strategies and resource allocation. The interaction between the host immune system and pathogens plays a critical role in the development and progression of osteomyelitis and septic arthritis. Host factors such as immunocompetence, genetic predispositions, and the presence of prosthetic materials can affect the susceptibility and severity of these infections. Elucidating these interactions enhances our understanding of disease pathogenesis and informs potential therapeutic targets. Biofilm formation is a crucial aspect of chronic infections, including osteomyelitis and septic arthritis. Biofilms provide a protective environment for microorganisms, rendering them highly resistant to antimicrobial therapy. Understanding the mechanisms of biofilm formation and finding effective strategies to disrupt these formations are key to tackling treatment challenges associated with these infections. Ongoing research strives to improve our understanding of osteomyelitis and septic arthritis and develop innovative approaches for diagnosis, prevention, and treatment. New insights in immunomodulation, antimicrobial therapies, biofilm disruption, and regenerative medicine bring hope for more effective management strategies in the future. In conclusion, osteomyelitis and septic arthritis are serious infections that affect the bones and joints. Detecting, treating, and preventing these diseases are crucial for better patient outcomes and reducing harm. Let's delve deeper into these subjects in our upcoming classes.